Okay, so the next thing we want to talk about is cardiac output. Okay, so you have to remember that the whole goal of everything that we've been talking about is to pump blood from the heart. Okay, so now the way that we measure that is called cardiac output. And basically, it's the amount of blood ejected by each ventricle in 1 minute. Okay, so cardiac output is CO, and it equals heart rate. So heart rate is measured in beats per minute, and it's multiplied by stroke volume. So HR is heart rate, and it's beats per minute. And then SV is stroke volume. Okay, now, here's an example of a calculation. So to calculate cardiac output, so at rest, a normal person, okay, their heart rate is 75 beats per minute, okay, and their stroke volume is 70 milliliters for every beat. So if you take 75 and multiply it by 70, you get 5,250 milliliters in a minute. So that's how much is circulating through your body every minute. So it would be like 10 500 milliliter water bottles. Okay, now each person, we're going to talk about blood next, has between 4 and 6 liters of blood in their body. Okay, so what the average for cardiac output is 4 to 6 liters per minute. Okay, so there's 1,000 milliliters in 1 liter. So if you take 5,250 and divide it by 1,000, you'll get 5.25 liters per minute. So that's cardiac output. Okay, so for a fit person who's exercising, okay, they could get up to 21 liters per minute if you're really fit and you're exercising. So that's like your maximum cardiac output. For someone who's a world-class athlete, so like think about like a world-class soccer player that's running constantly, okay, they can pump up to 35 liters per minute, which is kind of crazy. Okay, now, cardiac reserve is the difference between a person's maximum and their resting. Okay, so someone who is super duper fit, okay, so if their maximum was 35, okay, and their resting was 5, okay, they would have 30 liters in reserve to take care of them if there was an emergency, like if they needed to lift the car off their kid or run away from a bear or something. They would have a big cardiac reserve. Okay, so cardiac reserve goes up with fitness, but it decreases with disease. Okay, because someone that has a diseased heart is not going to be able to pump as much blood. Okay, now, heart rate, okay, is one of the components that's going into cardiac output. So when we measure heart rate, it's coming from the pulse. Okay, so you measure it from your pulse. It's measured in beats per minute. Okay, now infants have a really high heart rate, so 120 beats per minute. Young adult females, they say on average it's 70, normal is 72 to 80. Young adult males is 64 to 72. Okay, as you get older, your heart rate rises again. Tachycardia and bradycardia, these are persistent. And tachycardia would be consistent high heart rate. So they say greater than 100 beats per minute. Okay, and bradycardia is slow. So it's less than 60 beats per minute. Okay, so things that could cause tachycardia could be stress, chemicals, drugs, fever. So stress, fever, drugs that are stimulants, anxiety. Okay, low heart rate could be you're sleeping. Could be your endurance athlete. So some people that are like cross-country runners or distance runners, they have a really low heart rate. It could be that something's wrong with your pacemaker. Okay, so your pacemaker is going too slow. It's not setting the rhythm. Okay, now we want to talk about how we can change heart rate. Okay, so how could we change heart rate? So in theory, in our body, we want cardiac output to stay the same no matter what's going on. So if you're sitting or you're standing or you're running or you're sleeping, we want cardiac output to have homeostasis, to be constant. Okay, so if you look at heart rate and stroke volume, okay, we can change those things. Okay, so we could change your heart rate or we could change how much is getting pumped out. Okay, so the first thing we're going to talk about are things that could change heart rate. Okay, so chronotropic, so things that are chronotropic. So chronological, so this is time. Okay, so these affect heart rate. So something that's a positive chronotropic agent is going to increase your heart rate. Okay, so we're going to talk about different chemicals here in a minute. Okay, so they're going to increase your heart rate. Something that's a negative chronotropic agent is going to decrease your heart rate. Okay, now, your heart can beat by itself, okay, but it does have autonomic control. That control is located in what we call the cardiac center, and that's found in your medulla oblongata. Okay, so the cardiac center of the MO. Okay, now the cardiac center has two different parts, okay, that's going to run to the heart. So it has a cardiac acceleratory center. So guess what it's going to do? It's going to speed it up. Or a cardio inhibitory center, which is going to slow it down. Okay, now the cardio acceleratory center, which is going to speed it up, those are sympathetic neurons. The one that's going to slow it down is parasympathetic. So that all kind of makes sense. Okay. So it doesn't initiate heart rate, but it can regulate heart rate. So let's write that. Doesn't initiate, but regulates. Okay, so your heartbeat is a no-brainer, but you have some volume control. Okay, so you can control it with your brain. Okay, now, chronotropic chemicals that are going to influence heart rate. So some of the chemicals that are going to influence it are things like norepinephrine, epinephrine. So those are fight or flight hormones, so they're going to increase your heart rate. And that would increase cardiac output. Okay, drugs like caffeine. Okay, so caffeine is going to keep the cyclic AMP in the cell. Okay, so it inhibits its breakdown, so it's going to increase heart rate. Okay, now nicotine increases it. Okay, now some hormones. Okay, so thyroid hormone is going to increase it. Okay, electrolytes. Okay, of all the electrolytes, potassium is the electrolyte or the ion that has the greatest effect. Okay, so if you have an increase, it didn't see my little arrows. If you have an increase in potassium, the myocardium is less excitable, so your heart rate slows down and becomes irregular. Okay, now if you have a decrease in calcium, the cells become hyperpolarized and they're really hard to get to fire. Okay, now a rapid increase in potassium, okay, it can cause an increase in heart rate. Okay, and it can lead to death. And we'll talk about that when we get to the electrolytes. Let's see. So thyroid hormone increases the adrenergic receptors in the heart, so increases sensitivity to sympathetic stimulation, increases heart rate. My little arrows didn't transfer over. Okay, now the cardiac acceleratory center, okay, it's going to send sympathetic nerves to the SA node. Okay, and then the SA node goes to the AV, and then that goes to the myocardium. Okay, so the cardiac acceleratory center is going to secrete norepinephrine. Okay, and that binds to adrenergic receptors, and that's going to increase your heart rate. Okay, now, if you're really wound up, okay, your heart rate, okay, so if we're trying to keep cardiac output the same, okay, and stroke volume is going down, okay, so say someone's bleeding out, okay, so they don't have enough blood, so their stroke volume is decreasing, okay, their heart is going to try to compensate for that by increasing the heart rate. Does that make sense? So we want this to be constant. So if you decrease the stroke volume, okay, so say your heart's not beating very well or you don't have enough blood, so for some reason stroke volume is going down, okay, heart rate's going to go up to try to keep this cardiac output even. Okay, what happens is your heart rate, the effectiveness of your heart beating peaks at 160 to 180 beats per minute. Technically, you can crank it up to 230 beats per minute, but it doesn't give your heart enough time to fill. So your stroke volume will go down even more. So this isn't very efficient. Okay, so these bind to beta adrenergic. Have you ever heard of beta blockers? Okay, so beta blockers are blood pressure medicine that will bind to these receptors, okay, and they'll block the binding of norepinephrine so that your heart rate can't go up, okay, and it'll keep your blood pressure down. Okay, now parasympathetic. Okay, so parasympathetics rest and digest. Okay, so that's the cardioinhibitory center. Okay, it's part of the vagus. It's vagus nerves. Okay, so if things need to slow down, okay, we're going to stimulate the vagus nerve. Okay, the right vagus nerve is going to go to the SA node, and the left vagus nerve goes to the AV node. Okay, now, the vagus nerve secretes acetylcholine, okay, and this binds to muscarinic receptors. This opens potassium channels. It makes the cell hyperpolarized, so they fire less frequent, and heart rate goes down, heart rate drops. Okay, so that's how it works. Sometimes people rub. If someone's heart rate is too high, they rub the vagus nerve, and that can actually decrease your heart rate and decrease blood pressure. Okay, another thing that happens, and this is like my Elvis story, so the vagus nerve, if you bear down, like you're going to have a bowel movement or you're going to push a baby out, that stimulates the vagus nerve, okay? So that's going to secrete acetylcholine, okay? It's going to hyperpolarize the cells. It's going to cause your heart rate to go down, okay? And that'll decrease your blood pressure. So sometimes people pass out when they're on the toilet, okay? And that's because they stimulate the vagus nerve, okay? And their heart rate goes down, blood pressure goes down, and they pass out. Okay, now, this is interesting. Okay, so this is cool to think about here. This part is a little bit different. Okay, now, in our body, the vagus nerve is always connected to the heart. So that's supposed to be my heart. That's not a very good picture. So the vagus nerve is always connected to the heart. And it's always slowing down the intrinsic rhythm of the heart. Okay, so it's always slowing it down. So if it's not connected to the brain, it's going to go faster. Okay, so the vagal tone is when the vagus nerve is firing and it's slowing down the heart rate. And usually it slows it down to about 70 or 80 beats per minute. If you disconnect or something happens and someone's vagus nerves are severed and they're not connected to the heart rate goes up. The heart beats faster by itself. Okay, now if the vagus nerve is stimulated at the maximum, it can take your heart rate down to 20 beats per minute. So that lowers your cardiac output, that lowers your blood pressure, and that can cause problems. Okay, now, let's see. So we have, how many more slides? 7 more slides. Okay, now, inputs to the cardiac center. So we mentioned this before, the higher brain center. So you can use conscious thinking and change your heart rate. So you could make it speed up by getting anxious or by thinking about something that to get you excited or whatever, or you can slow it down. Other things are proprioceptors. So if you remember proprioceptors, they detect movement, so they'd be found in your muscles or in your joints. And if you are moving, that increases your heart rate. Baroreceptors detect stretch, okay, and they're actually going to detect stretch in the great vessels. So if the pressure drops, okay, the signal rate, I have to explain to you how the baroreceptors work. The signal rate drops. The cardiac center is going to increase heart rate, okay, and if the pressure rises, it's going to decrease heart rate. So the idea is we want to keep blood pressure constant. We want to be in homeostasis. Okay, so we want cardiac output to maintain constant. So if something's going on and your body thinks the blood pressure is going down in the aorta, okay, it's going to try to increase the heart rate to compensate for that. If the pressure's too high, it's going to decrease the heart rate to compensate for that.